Hello, Assalamu alaikum, good evening. Welcome to another program of Health is Wealth. I am your host, Shabnam Riaz. As always, we've got an information-packed program for you today, and we try to, address those issues that we know are affecting you on a daily basis. What can be more important, amongst other things, than your eyes and your eyesight? We have many people who have brought in questions as well, many concerns, because of course it's something that has a lot of myths and a lot of facts to be sorted out from each other. It's something that is so important. It's a blessing to, have eyesight, and to look after your eyes is something that, we should all know about as well. We need as much information as we can. So to talk about today's subject, we are very happy to have in our studio our experts, Dr. Amir Asrar, who is the Principal Consultant Eye Doctor, Amanat Eye Hospital. Thank you very much for joining us.
And thank you so much for inviting.
Our pleasure. And also Dr. Inayatullah Khan, who's also a Consultant Eye Doctor and Assistant Professor. Thank you very much for joining us.
Welcome, and likewise, I pay thanks to you for inviting me to this forum.
It's our pleasure. Okay, so today what we're going to talk about, what we're going to try to do is to address those common issues. Now, Dr. Amir, if I could start with you. You are involved in, laser surgeries as well, and high-tech, facilities that are available for people. How popular is laser treatment in Pakistan? How many people really know about it? And what challenges do you see?
Generally, laser is more like a common term that we use for surgery. There are quite a lot of surgeries being done which are not actually laser, but people label them as laser.
Okay.
Certainly, laser has got a lot of advantages and has made life of patients and surgeons far more easy. The recovery time has reduced and the accuracy has increased. We use laser for different purposes like removal of glasses, removing cataract surgery, treatment of diabetes, certain treatment of glaucoma, as well as cleaning of capsules. So we use laser as like cutting lasers, burning lasers, and for cosmetic reasons. Initially, when I came back to Pakistan in year 2000, lasers for diabetes, glaucoma, and other things were used very commonly and were acceptable. But laser for removal of glasses was not as common and was not really acceptable by people. But as time has passed on, it has really become more famous and popular, and the myths are fading away because the results are proving themselves to be far more stronger as compared to otherwise. But when we look into the things that we were doing, like year 2000, we were doing like more females, girls, because of certain reasons, like our culture problems of marriage and other things and appearances. We started.
That's the corrective eye
surgery for removal of glasses, actually.
Glasses, okay.
But by year 2000, what we started noticing was like boys were getting more interested. So initially in year 2000, there was like 1 to 10 ratio. Like if 10 girls are getting it done, 1 boy is having it done. But now it's almost like 50-50. It's like 1 to 1 ratio. I think boys have grown more aware of their appearances. They're more conscious about how they look. And secondly, they're more conscious about their working environment. Because if one is using glasses, it's definitely a hurdle because they become a nuisance if they get broken and you move out of the air conditioning, out into normal environment, or you're not able to do sports properly. So all these things have made more of the patients become aware about it, and they seek for more information regarding the same subject.
Right. That's a very valid point you made, actually, because we also, we've done programs on dermatology, so we've had dermatologists tell us as well that it's just not just the women who are coming in and the girls who are coming in for treatment, it's a lot of the males and the boys as well, so that's absolutely true. Dr. Inayatullah, before the program we were speaking about, your various areas of expertise as well, and you spoke about preventional blindness.
Yes.
Can you tell us a bit about that? What is that exactly?
There are certain diseases which are preventable and which are irreversible if not prevented at all. For example, glaucoma and diabetes. Let me tell you the sinister disease which is diabetes, and which is so much prevalent in our Pakistan, our country. Its prevalence above the age of 40 years is 45 to 50%. And the diabetic retinopathy, which is a disease that affects the retina, which is just like a film of a camera inside the eye. That part of the eye is affected by diabetes, and that percentage is, according to the recent survey, 19 to 21% of the diabetic population in any form, may it be a mild, moderate, or severe form of diabetic retinopathy. So, first of all, with your platform, I have mentioned the prevalence of blindness in these two conditions like diabetes and glaucoma, which can be prevented. How they can be prevented? As Dr. Amir has previously mentioned, the screening programs. And obviously, above the age of 20 and the areas where it is much more prevalent, the screening in the form of fundoscopy. What is fundoscopy? It is examination of the retina, which is the posterior or the backward part of the eye, just like the film inside the camera.
Okay.
So that can be screened out, because screening would mean that so far the eye has not been damaged by the disease, and we can catch it, and at that particular stage we can prevent such blindness. And same is the case with glaucoma.
But who needs that? Who needs that procedure?
Who needs that procedure? The procedure, one is at community level. There are many screening programs by our community hospitals. Like one of them is the Pakistan Institute of Community Ophthalmology, which is conducting a survey all over the country, in suburban areas and rural areas also. So they screen, they go in their teams and screen with the gadgets and record, and accordingly they refer the people who are affected to the tertiary hospital where they are being treated.
I see. Okay. Right.
Sorry, if I may add to the thing, just to make people more aware about it. Whenever we are diagnosed as a diabetic, it is important to have an eye checkup.
Okay.
We usually forget that.
Right.
Usually doctors tell them, but we don't take it seriously, and we just try to ignore the things that how diabetes is going to affect the eyes. Interestingly, this is the only part of our body that we can really look into. If we've got a diabetic retinopathy, that is like effect of diabetes on eye, this means our whole body is getting affected. This means our kidneys are getting affected. And this can be like first diagnosis that diabetes is really ruining our body.
So that's sort of the alarm bell
Absolutely.
that goes off.
Let me tell you, most of the cases of diabetes, not the diabetic retinopathy, are being nowadays diagnosed by ophthalmologists. The patient is not aware of the underlying disease at all. And diabetic retinopathy, you know, as Amir Saab has mentioned, that it is heralding something very serious, which is affecting your kidneys and many rest of the organs of the body.
What are the warning signs? When do patients come to you? What symptoms do they have?
With that diabetes, the decrease or the dimness of vision is the first sign.
Decrease or dimness of vision. Now this is very important, the tips that are being told. If you have any of these problems, you need to see your doctor straight away. The dimness of vision?
It's utmost importance in patients who are diabetic and who are at risk of developing diabetes.
Okay.
And we made some schedule for diabetic patients when they should see their consultants or their ophthalmologist yearly, 6 monthly and 3 yearly, depending upon the stage of diabetes.
Okay, right. Who are the people who are high risk of developing diabetes, and what should they be looking out for?
Whenever we look into diabetes, it's basically type 1 and type 2. One we get in early age group, the other one that we get after 40. The early age group diabetes is more dangerous for our body.
Okay.
There are many reasons behind it, like they've got to live more into the diabetic phase, plus they're more careless about it. Because in a younger age group, we hardly care about like what our health is going to be, and we suffer the most. Unfortunately, eyes get more aggressively affected in the younger age group as well.
So one is, I would like to mention, sir, with the duration of diabetes, the control of diabetes, the glycemic control, which we mean to say that the blood glucose level. The glycemic level means the blood glucose level. If it's not fluctuating, if it is well under normal control, the chances are then minimal of causing damage to your eye.
Okay.
So the duration, the glycemic control, the hyperlipidemia, which is increased level of cholesterols, the smoking, the obesity, and all these factors leads to damage of the eye by diabetes and many other organs.
Right, right. What other diseases are there that affect eyesight? Blood pressure?
The blood pressure is immediately following the diabetes, and these two, as I mentioned, two sinister diseases.
And both together is a very deadly combination.
And
Absolutely.
very deadly combination, and this is a vicious cycle, and are lots of finances in the public sector and the private sectors are being wasted by these two diseases, which are very much prevalent. So I think apart from directly treating the eye problems, if these diseases are controlled, so we are not going to have these problems on the eye.
Right. Dr. Amir, how much of a health burden are sort of like diabetes and blood pressure contributing to these eye problems, and how can we spread awareness?
Now, when we look into the top 10 causes of blindness in the world, they're like among the first 10, diabetes and blood pressure are there. Glaucoma, age-related macular degeneration, corneal scarring, all these are there, but these are the two major ones. And to simplify it, like just imagine there is a metal pipe which has taken rust onto it. That's diabetes.
Okay.
Now, if we increase the pressure inside, it's going to burst out, and that is blood pressure. So this is the combination between the two.
Right.
So we're making the things from bad to worse if we look at a combination. Now, having said that, diabetes is not only affecting the retina, it causes cataract, it causes variation in glasses. Like there are quite a lot of people who visit with the problem that they're getting, every time they visit a doctor, they're given a new number. This is one of the indications that they should get their blood sugar level checked up. Right. Because it could be because of the variation in blood sugar level that is causing change in the density of the lens inside the eye, leading to trouble in the focusing thing.
Right. Now, tell us about cataract surgery as well, because I believe we also have some footage that we can show our viewers as well. Tell us about that. How common is it in Pakistan? What ages are affected, and how is it treated?
Cataract is one thing that is more like graying of hair, as every one of us is going to go to a phase. If we are lucky to go into the age group, then certainly all of us are going to develop cataracts.
Oh, so this is something that everybody's
going
to.
Okay. Now, having said that, it doesn't mean that every one of us will need surgery for that.
Okay.
So cataract is like certainly what we call blurring of vision because of the changes in the lens. So our lens go cloudy, and we're not able to see things properly. They're more like non-focused or blurry. Initially, when we used to do cataract surgery, there was a large incision given, the lens was taken out, and then stitches put onto the cornea. But now cataract surgery has come in a long way.
The rehabilitation time is reduced.
Absolutely.
With the new developments and gadgets.
Right.
So all these factors contribute to the early recovery, and it's no more, I think, a very difficult surgery to be carried out, and the healing process is very much enhanced. As Amir Sahib will be elaborating further in details, the laser cataract surgeries, in which there is no blade used at all.
Right.
Which is a novel thing in our country, at least, if I'm not wrong.
Yeah, it is. This is the latest development that Dr. Anayat is talking about. Most of the places, what cataract surgery is doing is called phacoemulsification. Okay. In that, we use a blade to go in the eye. With the hand, we peel off the capsule of the front part, and then we take the ultrasound and take the cataract out and clean it up. Now, the latest advancement that we've been very fortunate to be like really on top of the world with this technology now is that we do not need blade. The laser is going to make an opening for us. It's going to remove the capsule by laser, chop the lens in small pieces. The only thing we need to do is to go inside the eye and take the lens out. Now, what we're seeing on the screen is the old type of laser old type of phacoemulsification.
Okay, this is the
which is ultrasound.
This is the ultrasound technique.
Okay.
And
that would take how long would that take?
That would take around like, in an expert hand, would take around like 5 to 10 minutes.
5 to 10 minutes. Okay. And let me tell you, the common misperception about this phacoemulsification is laser surgery. Basically, it's not a laser, it's ultrasound which is being used inside the probe, which you are seeing now.
Okay.
And this is the laser surgery, which is called the femtophaco surgery. He's going to elaborate in details.
Right, okay.
And now people do ask about what's the advantage of going in for a laser cataract, because they pay more and they expect more. The advantage is like we are going towards lesser complications, more precise results, and future to come, there are new things being added on in which we can correct the cornea, the astigmatism of the cornea, and other things. So certainly it holds a lot of future in it, and plus the safety margin is far better as compared to the traditional phaco.
Right. And you know, because many people are concerned with the financial aspects, around about how costly is that for a person to have this surgery?
At present, it's quite expensive.
It's quite expensive.
Yeah.
Okay.
We're talking something about like 100,000 for a case.
Yeah,
for one eye.
It is
For one eye.
expensive in perspective of our country and our population, but it's, I think, the cheapest in the world. In our
It is the cheapest. Like,
Yeah.
So that is important to mention.
Yeah,
Yes.
Right, right.
If somebody comes from abroad and get it operated, so if you compare the same surgery doing it abroad, it's very cheap.
It's
But
almost
for
like,
us, it is very
it's almost like
expensive.
dental work then, because you have many
Absolutely.
people who
Yeah.
are living abroad, but they prefer to have their dental work done here because they say
Absolutely.
there's much more of a
Correct.
So true,
difference
yeah, yeah.
in the cost.
Correct.
In a general practice, what we've noticed, like there are quite a lot of people who fly in, have the surgery done, and fly out.
Exactly. Right.
So, but on the contrary, the reason for these things being so expensive is because there's no research and development going on in our part of the world.
exactly.
that
And
is
that's
like
why
the
we
pity,
depend
actually.
upon the technology developed by
In
foreign
itself,
countries.
the technology should not be that expensive.
Right. So basically, people are paying for the technology that is being used. Why are we not researching here? Why is not?
That's like a whole
Yeah,
big
that's
discussion. You'll need to have a whole new
a
program
different
for that.
program on
yeah.
that one. Okay, so I'm going to talk about my concerns because if I, you know, well, not about cataract, but if for restorative eyesight, if you had laser, how painful is that?
Now, do you want to answer for this or like?
Well, it's, since your expertise, I would like your opinion. Then
Initially,
probably.
when we used to do this refractive surgery, it was really painful. It was like we used to feel the pain of the patient as well.
Really? I
It was
think you're
that
the first
painful.
doctor that has
Yeah.
actually admitted to a procedure being painful.
But now things have moved a long
Okay.
way. And then initially, when we used to do surgery, like in 2000, it was painful. The recovery was almost a week's time. But now the pain is for around 4 to 6 hours.
Okay.
And if we sleep over it, the pain goes off very quickly.
Okay.
And the recovery is within 24 hours. We are able to get 99% of our vision back within 24 hours.
And I would like to add further, Shabnam was asking about the pain during a procedure, I think.
Exactly.
So
Yeah.
I have seen patients and noticed that they sometimes even ask that at the end of the surgery, they ask whether, have you started this surgery or not? So it is
Really?
so.
Uh-huh.
it
So
is
during the
now.
procedure, it's quite okay.
Okay.
So
So
okay, there's no
how do you
problem
deal with
at all.
nervous patients?
Many of the patients have the phobia, the fear of being inside that capsule. Some claustrophobic patients are there. when
Because-
we
yeah.
put
Absolutely, the cap on and
the cap
everything.
on.
Yeah.
So,
So
there's some-
sorry, what is this? The cap on the cap? What's that? Can you explain that a bit?
Yeah. It's basically when the patients are coming into the theater, they have to lie down on a couch,
Okay.
and they have to be brought under the head of the laser.
Okay.
We drape the patient with tapes and put a spring to keep the eyes
So it's sort of like
open.
CT scan thing.
Not exactly. It's a CT scan is like really horrific. Yeah, it's
okay.
for the eyes, like even a small wee tiny thing is too much. So people are like, there's a fear of it, that what's going on with the eyes, because no
Exactly.
one has touched their own eyes for like ever.
That's true, because when you're thinking about
so
having something done
sensitive.
to your
Number
eyes,
of nerves are inside the eye. They are more as compared to rest of the organs of the body.
The good part about like the surgery is that we do not need injections. We do not need to sedate the patient. It's only a single drop and the eyes go numb. Absolutely numb.
We do, in other words, we do surgery with eye drops, putting eye drops. No other anesthesia in the form of injections or any other sedation. We just put eye drops and perform surgery. Even not only the refractive surgery, today while coming to your show, I have performed 6 surgeries with drops, intraocular surgeries, phacoemulsification.
And this, sorry, is what? Because I can't understand.
Phacoemulsification, as we have mentioned previously, the surgery for the cataracts.
For the cataracts.
In a public hospital.
Too
I
much
mean,
technical
yes.
knowledge involved.
Right.
So this should be
okay.
clarified.
Right.
We have not injected and we have not stitched even.
So do some of your patients say that did we have anything done? I mean, is it over? Or
Yeah,
we
I
haven't-
mentioned earlier that
Yeah.
many patients asked that
Okay.
whether it is finished or not yet the study.
Well, that's very sort of heartening for people, especially with low pain thresholds and the anxious patient as well. I think that for them it's
actually this evolution is in the last 3 decades. Before 4 decades there was even no intraocular lens, which is now presently we are having the sophisticated one which is implanted inside the eye. So we are lucky enough to be in this era.
Absolutely true. Dr. Naithula, tell us about, you're seeing lots of patients in your OPD as well. What amendments can we make as a society in general? I'm talking about childhood screening as well, finding out when a child needs glasses, and also diet, lifestyle. What things do viewers need to know?
First of all, we need to develop our community ophthalmology, which is dealing with the community and the screening and the dietary things, as you mentioned earlier. Regarding the diet, as there are misconceptions that eating carrot would enhance your eyesight and it would help remove your glasses.
Is that not true?
I'm not agreeing with this myth. He's sitting
The
with me.
only person who gets benefit out of it is the person
Bugs
who's
Bunny.
selling.
We're selling it.
So true.
Yeah. Secondly, of course, the dietary, the green leafy vegetable overall is good for it, but it's
Okay.
not specifically the carrots and anything specifically that goes inside the eye and that improves your vision. Because most of the problem with your decreased vision is in the front window of the eye, which is the cornea, the transparent glass-like structure. And the
Okay.
carrot cannot reach and the diet cannot reach because it's a structural thing, not a functional thing.
Okay, so that's
So,
one myth busted
yeah.
then.
Another thing I would
For
like
our
to
viewers.
mention, which is very, very important according to the recent study which has taken place abroad, is regarding the myopia, the nearsightedness.
Okay,
Is
myopia.
that the study inside the indoor studies, less play areas or exposure to the sunlight, that plays and contribute an enormous role in development of myopia and even its progression. So I would like the pupils, the students and the schools to have some playgrounds where the students can go during their break hours, or even they can study outside their classrooms. So ambient light and lighting environment, all these things contribute to the development of myopia. So
Okay.
these are really, rather than these traditional things, these are the factors which can halt down the progression of myopia and eyesight development.
Right, so that's really important information as well, to have a well lit room. What about when our parents used to always say to us, don't sit too near to the television because you're going to need glasses? Is that true?
That's basically, it's not absolutely true, I'd say. The reason one needs to sit near the television is because they're not able to see things clearly.
Ah, exactly.
Right? So they need to have an eye checkup. The other thing is, like, if when we are young, we do not get that much of an importance when our favorite television program is on. So everybody tends to pass in front of us. So to avoid that, usually kids sit in front so that they do not get distracted. So you just need to know that they also need space for their entertainment.
And I would like to mention that an amblyopia, a condition in which the eye gets lazy.
The lazy eye.
The
yeah.
lazy eye, what is a lazy eye? The brain is not getting the image due to malfocusing of that particular eye, or because it is not being the rays are not focused because of inappropriate number of glasses being given at appropriate time. When during the treatment of that amblyopic eye, we advise certain devices for the patients and for the kids to, as you mentioned, that one should whether go closer to the device or not, like television. So it's in sometimes it's a part of treatment, going closer to the device and reading it, if I'm not wrong, sir. So amblyopia therapy devices are there, in which you have to go closer to the screen and use your lazy eye so that you come up with that problem, and it's developed and the brain gets that signals.
So in short, sitting close to television would never disturb your eyes.
Okay, all right. Okay, so tell us about, nowadays, what are we seeing? Things have changed. You have all these gadgets, bright lights, mobile phones, iPads, all these things that even very young children are being exposed to. And you'll see that, even at night, the they're looking at a phone or an iPad or whatever. How damaging is that for eyesight?
I would, it's just like synonymous with the foods, the increment of the food in the last many decades. Many of us are getting obese, many of us are getting diabetes because of the availability of food, which was scarce in some 50 years back, and that is why we are getting diabetes and hypertension. Likewise, these gadgets are just like availability of over food, so they does harm the eyes in the form of radiation of ultraviolet rays and other radiations. So it's not very good for your eyes. Rather, it adversely affects your vision.
So what other sort of, tips that you have for people who are, many people are addicted to their phones? And
first of all, it's very difficult to abstain somebody from not using such gadgets. Decrease the frequency of the usage of some gadgets initially, and try to divert your attention to some other things, like for example television can help. The alternate way is to watch the television instead of these gadgets and these devices. So this is how one can have a remedy from these things.
okay.
Sorry, if I could just add on to it before we move on to another thing.
Yeah.
There's a very interesting rule that was introduced by the American Optometrist Society, in which they said like it's a 20-20-20. That means that after every 20 minutes of continuous use of computer or like any gadget, one should stare at a distance of 20 feet for 20 seconds.
Ah.
So that's like easy to
That's
remember.
very easy to remember, exactly.
Yeah.
Very easy to remember. So that is another tip for our viewers. 20-20-20. I mean, even I can remember that one.
And the simple thing I would like to add is that while you read a book like this, for a few seconds you focus for a far object. There is another remedy
to reduce the strain.
Absolutely.
That is on your
Yes,
eyes.
that's
Okay, stay
important.
with us. Don't change the channel. We're going for a break, but we'll be right back. Okay, welcome back. Well, we're having, a really informative program right now. We're speaking about all those issues and those diseases about the eye. We've had a couple of myths busted as well, and there may be things that, you've sort of ingrained in childhood, but one was the carrots, and the other was not sitting too near to the television is not going to really ruin your eyesight. Okay, Dr. Amir, I was going to ask you just before we went to the break, you were saying that laser is also being used for cosmetic purposes.
That is true.
What are those?
One thing is the glasses, the main issue.
Okay.
But there are oculoplastic surgeons who are using different type of lasers, like diode lasers, for blepharoplasty. That's like the saggy eyes. And when there is a droopy eye from the top, they use those lasers to correct them.
Right.
But that is not my specialty. There's like actually ophthalmology or eye surgery or eye field is divided into 12 different segments. And I am more into laser and cataract, that is refractive and cataract.
Okay.
But there is a field called oculoplastic in which they really deal with this, and they're like doing a fascinating job.
Yeah, we did an earlier program with one of the oculoplastic surgeons as well, who did.
I think that was Dr. Tahir.
Exactly. Yes, he explained all that to us. Okay, how many now? And one thing I really wanted to ask was contact lenses, their usage, and how many patients have you ever seen that have had to come to you because of damage caused by contact lenses?
Contact lens use is quite a common thing actually. and it's been prescribed like at every optician's shop or other places as well. But one of the most important thing is whenever the contact lenses are being prescribed, it has to be prescribed by a proper person who has got a training. It should not be prescribed like just off the shelf, or person should not just buy it for the sake of using it. Whenever they've been prescribed, the patient who's going to use it should have a proper sitting with the optician, knowing the advantages and disadvantages, the caution when they need to come back and report to a doctor or an optician, and when they need to change the contact lens. The proper care they need to take, that is like a special solution, because there is another thing that usually patients come in with an infection in the eye, and whenever we take the history, they have ever slept over with the contact lens in the eye.
How dangerous is that?
It's like pretty notorious. Like it's not something that we should ever try experiencing that, because even if you're like safe from an infection, it's a very painful condition when they take off the lenses in the morning. The other thing what usually people do is like they use their own saliva like a lubricant to put the contact lens in the eye, and that's like the worst thing that one can do.
Right.
Or wash contact lenses with tap water to save some money. That's even worse.
Okay.
Because my saliva bacteria are good for my mouth because they're going to protect the infection in my mouth, but they're not good for my eyes. It's a totally different place. And once this transfer happens, it can cause quite a lot of nuisance. The most common infections that we see with contact lenses are the bacterial, the viral, and the worst one are the fungi.
Rest of the effects or the damages caused by contact lenses, they were elaborated in detail by Amir sir, but I would like to mention one serious thing, that is the ultimate consequences of the contact lenses, which I have seen many of the patients in recent years, is that the whole eye has been removed because of a damage and infection caused by the contact lens, which is not amenable to the conservative therapy and the corneal transplant, which we call keratoplasty. So one should be careful in the early stages of the infections or the inflammation, which we call the contact lens related acute red eye. So immediately one should seek his advice from the physician, so that it do not lingers on and leads to the ultimate, the damaging stage of the contact lenses, which is called the evisceration and removal of the eyeball we have seen. So it is not that simple thing, the contact lens and its issues.
Okay. So I mean, what led to that? What
the
happened?
infection caused by the contact lens and the inappropriate remedy or medications given appropriately and timely, leading to the lingering on of that infection involving ultimately the whole eyeball, which is not curable then.
Extremely. That is
Yes,
quite scary.
It's
quite
like
frightening.
having said all this thing, it's not like the contact lenses are the trouble.
It's the usage.
Exactly. Like people are not aware of if the trouble comes in. And since, as we were during the break, we were discussing about that we are laid back people, we do not attend to the doctor when it's the right time. So these are all things which add on to the trouble. Now, there's another interesting thing that Anat was talking about, the transplants. People come in and say that, can I have a new eyeball? That's not possible. That's a myth. A whole eyeball cannot be transplanted. There are very few things in the eye, like cornea can be transplanted. We can transplant an artificial lens in the eye. We can put an artificial iris onto the surface of the lens. But a whole eyeball cannot be transplanted.
And that
is
the reason for that is all your films, and you know when they've said that.
It's very important because in a
interest.
public hospital, as Amir knows, that I am frequently dealing with the corneal transplants and the corneas, which are not available here in our country because of some constitutional problems and due to some rules and regulation. We are being given and donated this by Sri Lankan government and many other countries in the world. So many patients from periphery come up with the hope that our whole eyeball can be transplanted and the disease can it be curable, since there are many diseases in which that is going on since the childhood. So it should be with your platform. We want this awareness across the country, that it is only the outermost covering, which is the window to the eye, which is in the form of a glass, and which is called the cornea, that can be transplanted.
That is what is being
and that is having the
transplanted.
very good results.
Okay.
And which we are doing it frequently here.
But the problem lies that we have to get those corneas from Sri Lanka.
That is a problem.
And other places.
and
as
other
well.
places
Yeah.
as well. Okay. So those are definitely people who are on the donor lists. Are
Actually,
they? So,
there is an embargo or some constraint locally. There is some constitutional, problem in our country in which the donation is not allowed locally. So that is the
I
main
think we
thing.
need to educate more people about it. And like I've worked in Ireland and England and other places.
yeah.
And generally in educated societies, almost 90% above people have got the cards in the pocket in which
Exactly.
they donate their eyes, their heart, their lungs, their kidneys. Because I don't think we need them while we're in the grave. But
Absolutely
this is
true.
what we need to educate people
We need to have
about.
discussion.
Right.
I think the first thing is that, remove all those things that people...
The bars and everything. Yeah.
Exactly, the hesitations.
And,
Exactly.
And in our country, there's a human organ transplant authority. That needs to be a bit, flexible also in this regard. That should not impede the normal process of corneal transplant. Even the corneas which we are getting from abroad, there are many, many hindrances. And very,
of
very
course.
small
Must
things,
be.
they need to be removed by the Human Organ Transplant Authority. So these are many the problems.
Other thing, in the part of discussion what Anand was talking about, there is a lot of thing going on as interfamily marriages.
Ah,
And there are
That
lots of
is a
diseases
very-
which are being transmitted from parents to the
Okay.
offsprings, to the offsprings, and to the offsprings.
again, diabetes and blood pressure.
Absolutely, like
Compounding
night
them.
blindness
Night
and so many
blindness,
things.
the retinitis pigmentosa. A big chunk of it is transmitted through genes. And
How many people know they have night blindness? Do you get patients who come over to you and you've sort of told them and they've been amazed to
no,
realize?
they know their problem when they come up there, but they do not know which type of night blindness is this and why has it caused. So as Amir has mentioned that cousin marriages and inside the family marriage, they contribute a lot in
Right.
that regard.
Right. Dr. Amir, tell us about colour blindness.
That's an interesting thing, actually. There's another myth involved in it, that males get it and females don't. And that's
Okay.
not true.
It's
Yeah,
equal,
it's,
is
it's
it?
not, no,
Possible?
not equal.
Not equal.
Is like I would say like 6% of the 6% of males do have color blindness,
Okay.
and that's also like from various degrees. But females have less than 1%.
Okay.
But is there?
Right. And is this something as well that's passed genetically?
It is. And now the other thing that we really need to look into is that there are quite a lot of rules and regulations as far as jobs are concerned, where we have to be very strict about color blindness. And there are other jobs which do not need color things, but the rules do exist for that. The same thing is like we need 6x6 vision or 20/20 vision
For many jobs. That's true.
And
so how is colour blindness, is there a treatment? Is it managed?
Unfortunately, there is no treatment for
No
it.
treatment, it's managed.
But like, say for that matter, if a person is working as a policeman and has got a color blindness, won't be able to see the traffic lights. It's a very simple thing.
Exactly.
A train driver cannot see colors is another troublesome thing. But if a person is working as an office boy or like someone who's just got to sign papers, it's like quite
That
okay.
it
It's not
won't
going to affect the job.
Impair him
But
in any way.
unfortunately, the rules have been laid, and no one is there to decide. Like these type of jobs have to be taken out of it.
Right. So you were saying it can be genetic, or it is always genetic, or can anybody develop it?
It's more like genetic.
It's more like genetic.
It's genetic, and we divide this condition into genetic and congenital or acquired. The acquired condition which leads to color blindness at very later stages, glaucoma can,
Yeah,
and many
so
other diseases can.
like
later
AMD
on.
and things.
And another thing about the color blindness is that various people get and are affected at various stages of their life. This is important. Yeah.
So if you're
It's
not,
not that-
colourblind, you can be
Like,
later on
yeah,
in
the
life.
interesting part is like the back part of the eye. is divided into two parts. The central part, which holds 90% of vision, is basically responsible for the color vision as well.
The
Okay.
cones.
And the side or the periphery, which is responsible for 10% of our vision, is basically the navigational part of the eye, and that is responsible for day and night type thing. Now, if the central part is gone, then certainly we're not able to see things clearly.
Right.
The colors are like significantly affected. But on the other side, it doesn't mean that the central part is gone and we are totally blind. We may not be able to identify things and to see.
Apart from the color.
Yeah. And but we'll be able to manage. We'll be able to walk around and do our jobs. There is a disease called age-related macular degeneration. This is one of those ones in which the central part goes away with age, and we are not able to identify things, not able to read things, unable to recognize faces, and that's more like a legal blindness.
Okay.
And this age-related macular degeneration is less prevalent in our country because it takes place and it's relevant and related to longevity of life. So that age-related macular degeneration is more prevalent in the Western countries,
Right.
Western part of the world.
Okay, where the age
So,
expectancy is.
Yeah, I would be a little bit like to differ with Dr. Nath because initially what we thought was there were quite a lot of diseases which were like more prevalent as we thought in European societies and rather than ours. And the reason is like there's a very famous saying that the mind would not know what the eye won't see what the mind doesn't know. So if we're not looking for a thing, we will never see it. For the ophthalmology developing and with more gadgets and things, we are seeing those diseases much more commonly, which were not being like seen even before. So as glaucoma is far more prevalent as we thought about it. Same as goes with other eye conditions.
But there's just so much to talk about because, of course, this is such a diverse field and we have had the opportunity of having experts with us. Just before we end the programme, I'd just like to ask you about the weather as well, the influence of weather. We are subject to extreme weather here in Pakistan, especially, you know, the summer and the monsoon as well. Is there anything you can do, preventive measures, to look after your eyes?
I think apart from weather, or like in addition to the weather, the environment is the worst thing.
Right.
We're cutting trees, not planting them. We're just trying to do everything that we can to ruin our environment. That's leading to allergies, that's leading to a lot of corneal diseases. The external adnexa, or the external part of the eye, is totally dependent upon the environment that we live in. Dry eyes, irritable eyes, watery eyes, red eyes, all these things are because of the bad environment that we live in. Certainly weather holds a lot of value to it because if it's hot, dry, humid, too cold, all these things are going to further add on to it. For this thing, we really need to look into what we really want for our children.
Exactly.
If we want them to grow up in a healthy environment, we need to take care of it. There have been so many pictures on WhatsApp and other things in which we see like the dump we create while visiting places.
Yes.
That's not good for us and for our children as well.
And that's the awareness that, I mean, that's something that doesn't cost anything.
Absolutely.
All you need is a bit of civic sense.
Yeah.
These are things that have to be inculcated. Dr. Naidra, just briefly, dry eyes?
Well, the dry eyeness, first of all, I would like to mention that what the dry eyes are basically. Most of the patients and the people across the street I have seen, they are not aware of what the dry eyes is. The dry eyes are basically, its symptoms are so variant that people will come up to you with simple headaches even, not the eye problem.
Really?
They have role strain in their working environment because of this dry eyeness. What is dryness basically? Your eyes and the lid margins, they secrete oily material, and the conjunctiva, which is the membrane covering the eyeball, that has ducts which secretes aqueous, which is a form of more of water content and mucin. So deficiency in these three layers, which are normally secreted by the eye, if any one of that is affected, that leads to dry eyes. And its symptoms are so varied that it needs so much investigation and techniques to diagnose it and properly remedy for it. So it can be, a long-lasting disease if not properly cured.
Right. Okay.
Can I add a few things to the
Sure,
dry
sure.
eye? Like, it's a very interesting thing that the dry eye can present in different forms, like irritable eyes, red eyes. People know that they have got dry eyes. One of the most interesting and the most difficult part is when patients have got watery eyes and the condition is actually a dry eye.
Uh-huh.
And
That is very important. The dry eyes
Very
patient,
fascinating.
yes, the dry eyes doesn't mean that they would
That's
not
because that's what a
lacrimal.
person would think.
Yes.
Yeah.
so that is
The watering
I think-
eye, the dry eye
Is
may
that the
present.
eye compensating, overcompensating?
Exactly.
I have
Like-
mentioned previously that the symptoms are so variant that the watery eye may present as the dry eye may present as a watery eye.
So true. So true. Right.
And then it becomes really difficult to convince the patient that you have got dry eyes because the tears are not holding into the eye, they're just falling out.
In which condition we call tear film instability.
Right.
So they are not stable, not holding up there. That is why they wash away or run away in the form of tearing.
Okay. Dr. Amir, Dr. Naidullah, thank you so much for being part of today's
Thank you so
program.
much.
It's
Thank you
really
so
been
much,
so
Thank you very
informative.
much.
I've learnt so much, though. I'm sure our viewers have really benefited from your expertise. Thank you so much.
So much grateful for
We are
inviting. Thank you.
grateful to you. Thank you.
It's our pleasure. Okay, so I'd like to end today's program as well with a public service message. You know, what the doctors were telling us. Think about your environment. Think about all these things you're going through. I mean, this is something that's so easy, a bit of civic sense. Don't litter. And if you see somebody else littering as well, you know, make some sort of an effort. Teach your children that this is the country that we have been given. It's a blessing, and we need to look after it. Same way we need to look after our health. We need to look after ourselves as well. Don't run to the doctors last minute because, you know, it's hard for them to perform miracles. If we are more conscious of our health that has been given to us, that's also a blessing too. So we will lead a more productive life. Okay, so till next time, stay happy, stay healthy. Bye-bye.